Hello, and welcome to Level of Crazy, the podcast where we discuss all topics EQ and we get your crazy going. And it is all about healing the divide within ourselves and with each other, optimizing our emotional intelligence and emotional quotient so we can be better humans and get that crazy under control. Today, we have an amazing guest with us. He is definitely near and dear to my heart. Tom, I'll get to you in a second. Paybacks are a bitch. He did that to me at my 50th birthday party. So I had to put that in and get him back. But seriously, today we have my partner, Tom, and the founder and I would say the master occupational therapist and acupuncturist specializing in vestibular balance therapies and so many other amazing things besides that. But today we're going to talk just about the vestibular balance therapy and what is Florida Balance Centers and all the magical things that we do there. So I'm so excited to have you on, Tom. How are you?
Good. Thank you, Esther. It's an honor to be a guest on your show, and I think this is really exciting because you're launching this new podcast. I love your cape, the EQ symbol, your signs in the background. Everything looks amazing. So you're doing a great job. I'm excited to be a part of this podcast today.
Well, I want to give props, obviously, to you because, as my partner and as we are going to be talking about Florida Balance Centers is our sponsor for these podcasts. And so I really want to shout out to you as my partner and also as the owner of Florida Balance Centers and thanking you for helping us, making this possible, allowing me to fulfill my dreams of EQ awareness and helping the EQ Institute continue to do what it does best, which is educate, inspire, and help people optimize their emotional intelligence. So thank you so much. Let's get into it, shall we? So let's first discuss, so people can get an understanding of your background. Give us a little bit of your professional credentials, and then we'll continue from there.
Well, I'm an occupational therapist. I love how you introduced me with that. And I don't consider myself a master, but I do specialize in vestibular and balance rehabilitation. I've done so for approaching 35 years. Or at 35 years of doing this. I was fortunate enough as an occupational therapist to have met and studied under an amazing neurootologist back 35 years ago who knew me from working at University of Miami and wanted to develop a program for patients with dizziness, vertigo, and balance problems. As a physician, he was limited to what he could do surgically or prescribe medically, and many patients, needed a rehab program. They needed a way to utilize exercises and various treatment options we have as therapists to improve their ability to use their their inner ear sense, their sense of balance. Not the hearing portion, but the balance portion. So it was a privilege, and I was at the right place at the right time, and I got this tremendous exposure to this specialty, being actually one of the first therapists in the state of Florida to put together what our name of the program is. Florida Balance Centers is the name of our practice, and that was developed in 1992. I incorporated that. So from there, after being in practice for several years, I discovered the art and science of acupuncture. I was so impressed with the tools of acupuncture and Chinese medicine. I went back to school and got licensed as an acupuncturist. And so I was able to utilize both of these licenses in this practice to help really facilitate health and wellness in patients suffering with these chronic conditions. And we treat a variety of conditions also. The therapy is primarily directed at the vestibular balance program, but with acupuncture, I could treat a variety of conditions, and it's been an amazing combination to put the two together. So I feel really blessed and grateful that I've been able to facilitate health in this way.
That's amazing. So, and that's really incredible that you were able to find the time, find the space to go back to school and to make that happen. And, and it seems like it's a great compliment because, acupuncture is an amazing modality. I've had acupuncture even before we met. I had acupuncture, and it's an amazing tool for so many
I know you
things.
were cheating on me with another acupuncturist, if I recall correctly. So I remember.
That is true. That is true. But actually, I had acupuncture prior to meeting you.
Yes.
And so acupuncture I know is an amazing tool. So I'm really that's really great that you are able to do that. And it's actually another amazing tool that we'll talk about at a later time. And maybe we'll probably have you on to talk specifically about acupuncture, and how that is amazing for our EQ as well, because it's very good for stress, pain management, and so many other things. Fertility, right? We've gotten several people pregnant.
My job.
So, right? Okay, very good.
Yes. Well, I'll do
So,
that on one condition. I'll come back as an acupuncturist on one condition, Esther. As long as I'm the only one who's sticking it to you.
yes, honey. All right, let's
You're not
thank
cheating
goodness
on
that
me with any other acupuncturist.
I'm an undercover comedian. So this show has all kinds of stuff, folks. So you never know what's going to happen. All right. So yes, I agree, Tom. I give you definitely that commitment there, that guarantee.
All right.
Um, okay. So tell us a little bit about what is vestibular? What is this vestibular, um, inner ear, vertigo, dizziness, balance? What are the difference? What is the difference between vertigo versus dizziness versus balance issues? I've had vertigo myself, so I can definitely tell you what vertigo is. Um, and as a result of the vertigo, I had major balance issues. But that was only for that time that I had the vertigo. So if you could give us a little bit of an understanding of what is the difference between all these different things.
Oh, yes, very good question. Vestibular rehabilitation, or I call it vestibular balance rehabilitation or vestibular balance therapy, VBT, because we're dealing with the inner ear primarily. The inner ear is mostly considered to most people an organ of hearing because it's associated with the ear. However, there is a separate organ that sits inside the inner ear next to the hearing mechanism, the cochlea, that's called the vestibular system. And this system is comprised of three sets of rings that pick up head movement in various directions with sensors in them, and another sensor that has weighted crystals in it that tells us which way gravity is affecting us in its relationship to our head position. That's just a brief just quick little summary of what that does. There's a little more complexity there. And we have two of these mechanisms, one in our right ear and one in our left ear. So this system is there to support us in how as we move around in our environment. So we really shouldn't even know that this system exists until something happens, and that's the kind of patients that we see in our clinic will come to us with either vertigo. That's one of the main symptoms for many people, but also many people who don't. We see many patients who don't have vertigo, and they're simply feeling what they call dizzy, or what I like to use the word is woozy, because we don't want to we want to differentiate vertigo from feeling lightheaded, swimming sensation, sway sensation. They're very distinct symptoms. And oftentimes it'll affect someone's balance. So we have to address the whole balance system. And just to give you another little brief synopsis about why we include the word balance in there, balance is a very complex thing to analyze because it involves sensory processing. Part of that's the inner ear. Part of that's the sensory feeling in our legs. And another part of that is our vision. And then the other part is our motor coordination, how we react, how we use our muscles, and how our nerves and muscles are responding. So this system is constantly working all the time. We're feeling where we are, and we're then ready to take a movement through our environment. So hopefully that gives a general enough description of what the foundation is of this kind of rehabilitation. So anyone who's struggling with balance and or unusual sensations like lightheadedness or swimming sensation or worse, vertigo, then we step in, evaluate, and begin the treatments for those conditions.
Thank you. Very interesting. Quick technical tip. When you start to speak, just speak up louder because there's a little bit of a delay in the volume. So if I could ask you to just please speak louder, the minute you start speaking, just project your voice.
What if that's coming from the headsets? I mean, I don't know if that's
Yeah, something.
possible.
Yeah, so we'll just make do. Hopefully it'll improve, but right when you start talking, there's like a lower volume and then it picks up. So if you can speak louder, that would be amazing. So Tom, tell me, how did we met, and we won't talk about that story. We'll talk about that story at a different time on a different episode. But when I entered with the EQ work, with my emotional intelligence work, how do you feel that having this work now in the clinic has helped or not? Obviously, I'm still there and we're using the work. So I'm assuming it's worked and it's helped. But tell me how you feel as a professional therapist. How did the work enhance the practice?
Yeah, the work has been extremely fantastic. It's been helpful because we can have conversations with our clients, with our patients, about how they're dealing with the process of recovery or how they're viewing their conditions or their limitations in life as a result of this condition. So, or any condition they may have, whether it's we're seeing them through acupuncture for stress management or pain issues or fertility or gastrointestinal problems or migraines, whatever it might be, TMJ problems. It's how are they looking at and viewing their process of recovery. That has a big effect on how well patients do. So your work, your EQ work, you put up signs in the clinic, you come in and have discussions with the patients, you go through what their challenges are, where they're at emotionally when they're going through this process. Do they have an optimistic outlook or do they have a pessimistic outlook? Do they feel they're going to have to live with this for the rest of their lives? Or are they motivated to move forward and do the work it takes to optimize their recovery? All that matters, and you've been instrumental in being a motivator for them and helping them to get over many obstacles, emotional obstacles in particular.
So what I hear you say is emotional intelligence is vital when you're dealing with an illness or some sort of physical limitation due to.
Absolutely. Absolutely. Because one thing, we can't do is instill the will for someone to do work towards their recovery. Oftentimes patients, are living busy lives. They've got families they're raising or they have relationships they're in. They're dealing with maybe financial issues, other stressors, caring for parents. So it's a whole realm of things that is going on in a patient's mind while they're in the process of trying to deal with an illness and overcoming this. So to have the conversations about this, I think opens up and helps people to move through it quicklier. I made that word up. Move through it more quickly, and to like be able to really kind of move through in a more powerful way. It would be another way I would say that. And your
So let me,
techniques and
mhm.
your cues, your timing when you come in and speak to people and share stories or ask them to share where they're at and what they're going through. I think all that just really tremendously helps. And plus, you're very funny in the clinic. We do get to make the patients laugh quite a bit. So I find that humor is one of the best EQ tools we could have.
Yes. So humor has been said, it's the best medicine, right? So one of the things I want to ask you before we continue more about the clinic is how do you recognize and manage your crazy when you're working with patients and, dealing with a busy day and you have, you know, balanced patients, you have an acupuncture patient, you have me asking you questions, you have, phones ringing, you have people, dizzy and upset and I would say we're a pretty orderly clinic. It's not like we have urgent issues or 911 type of scenarios, but we've had some vomit. And Esther's usually the one to go pick it up and clean it up.
Yes, I was just going to say, all those things you described are the things you help me manage. So my EQ is sitting right there on your cape. It's you're the EQ expert. You help to smooth things out during our day. I stay focused on the patient's needs. I stay focused on listening to what they're saying, hearing where they're at, trying to understand any challenges they may be up against, and then to design a program which is constantly moving them forward, help adjusting the challenges to their levels so they continue to improve their ability to use their vestibular system.
Do you ever find yourself at a loss of what to do next?
Um, that happened earlier on in my career. I think now with 35 years of experience, I don't feel as much of a loss. There are times when patients are on complicated medications or have had medication use that may affect the central nervous system, and then that becomes more of a challenge, but we have to work on the system anyway. So we find ways around that as well. Some people need a little more rest time between exercises, or the exercise need to be adjusted so that they don't feel so much of a spike of their symptoms while doing them. So I don't think there's anything that really holds me back except the patient who's unwilling to do the work.
Yeah, I agree. By the way, technical tip, whatever you just did worked really well with the sound. So I think there's maybe a dead zone. So how you were sitting just now was awesome.
Okay, because I've not
Yep,
done anything
that's
else.
it.
I'm still in
That's
my,
perfect.
okay,
Yes, that's
okay.
perfect. Whatever you're doing. Um, so tell me, let's describe what do we do in the clinic, right? So if we had, the listeners may want to know, so tell us about this clinic. You guys are so excited about it. What's so fascinating about this place versus another place?
What I guess the thing that stands out for me is that it's we're a real fun and comfortable setting. It's you're not going to walk in there and feel intimidated. You're going to feel welcomed. You need from the waiting room and the way we have it designed and the ambiance in there, a little bit of music. You're at the front desk, so they get to see you first, that beautiful smile of yours, those beautiful eyes, and you get to talk to them a little bit. You've already talked to them on the phone. So we've created this wonderful environment of providing healthcare. We call it sometimes our boutique practice because it's very catered to each individual. And we create a warm, friendly, fun environment. Many of the patients get to know each other in the process of this recovery. Some patients are new, but they might then see another patient in the clinic that has been there for a while and is moving towards graduation, or they might be halfway through the program, and they'll often have conversations and share about their symptoms. And it creates an environment where a patient no longer feels alone with their condition or their symptoms. They can see other people going through similar process, and that adds to the motivation for their recovery. They can see maybe a little bit of the light at the end of the tunnel when they see other patients who are going through the process as well.
So tell us a little bit about what is it that we do in terms of a treatment. You know, some patients will
Okay.
ask me on the phone. They'll say, "Okay, well, what is this? What are you going to do to me?"
Good question. So one of the first things we do, you've done a bit of an intake, getting information about them. We have forms that they'll fill out, health questionnaires. I'll take those forms. Well, on that first visit, I'll sit down with them face to face, and we will go over their intake, the information they provided. I'll ask additional questions about their condition. I want to know maybe how long they've had it, when did it start, what the symptoms were like, what treatments they've gotten so far, the medications they're on. And then we have a series of questions that we call the Dizziness Handicap Inventory, which tells us about how they're managing their everyday life activities, both functionally, emotionally, and physically. As an occupational therapist, one of our main goals is to help people get back to their daily activities again. When they have a condition, it sometimes can limit their ability to participate in activities they were doing before, now that they have this condition. So we're looking at ways to help them integrate and get back into action, back into living life again, and doing the things they want to do. So after we do that intake, I begin a series of testings or screenings. As an occupational therapist, I'll take a look at their eyes with a special set of lenses, looking for a thing called nystagmus. I'll do positional testing, checking for what we call positional vertigo, or the medical term is BPPV, benign paroxysmal positional vertigo. I go on to do some vision testing, because the inner ear is responsible for what we call dynamic visual acuity. So we'll do vision testing. I'll do some functional balance tests, look at other issues with their sensitivity to their feet. Do they have neuropathies? Do they have any injuries to their foot or neuromuscular systems? Look, I'll do a manual evaluation of their neck, maybe TMJ areas, to see if there's any tension or problems. I often ask about sinus conditions, because many times this vestibular dysfunction or vestibular disorder is caused by an underlying pathogen, which is irritating the system. So we not only want to help them recover, we want to get to the root of the problem if we can, to help prevent this from happening again in the future. And we do go into nutrition at the same time. You've done an amazing job of putting that into a pamphlet, and I review that with them, go over with them some of the troublemaker foods we'd like them to pay attention and avoid, and some of the foods that we think will help them optimize the recovery. So with the EQ involved as well, their mindset, they leave that first visit. Oh, and then we do finish that eval with a computerized balance assessment. So then I get an actual rating, a visual rating, a graphic rating of their balance status, and that's them compared to men or women in their age group, in their own age groups, normative data. So we get a printout that we can objectively look at. This is where your balance is at the time of the evaluation. We send those reports to doctors when we need to, and we send a plan of treatment and a report describing what we found. Over the course of therapy, then, will we do the specific exercises and give them home exercise programs? We keep that, specific to each person, and we keep it to a minimum so that they're motivated to do it. And then we reevaluate over time. Usually patients, might be seen for 4 or 6 weeks. Some might be seen for 12 weeks, and some might be seen for 6 months or a year. So it all depends on each person's condition. So
And
hopefully that
then
explained what you're asking about as far as what do we do when we first see a patient.
yes, very thorough. Thank you. The the interesting thing that I've noticed, and tell me if this is the first time that you've experienced this, because we've only been together 5 years, and my 5 years in the clinic, I've noticed that people love the therapy so much that once they get to the rehab part, to the maintenance part, we have patients that come now and pay privately because they just
Yes.
really love what we do. They love the maintenance. They love being in that social environment. I mean, people are coming now. We talk about all kinds of fun things, and it's almost like it feels like almost like a gym, like people come and work out and do their vestibular balance therapy, and then they hang out with their friends and they go home, and it just feels like a real community. And I think that that's something new, right? That has happened just now recently.
It's happened periodically over the 30 years where people come and want to maintain their gains. Some insurances won't pay for maintenance, so we take some insurances when we can. But that's just a sign of how motivated they are. They've participated in our program, they've gotten better, and they know they want to stay well. So they might come in, once a week or twice a month after they've, achieved the improvements so that they maintain these gains. Many other patients will just continue with their home exercise program, and we might not see them unless there's a relapse, and hopefully there isn't any at all. And then sometimes we hear from them, or you might follow up a call, you might do a follow-up call with them, and you'll find out and you'll say to me, Tom, I called so-and-so and they're doing great and they're really happy and they thanked us for our program. So we have a very good variety of ways that people use our program, and I'm pleased with that.
Yeah. One thing I wanted to tell you, I forgot to tell you actually, and it just popped into my mind, is earlier today we got a call from a doctor's office. And I'm not going to put it out there here, even though I could totally do a plug for them. It's Dr. Contrucci's office. They're
Yes,
amazing.
great doctor.
Dr. Contrucci and Dr. Toro, and they are in Pembroke Pines. I believe they are ENTs, right?
That's correct.
Okay. So, and they refer a lot of patients to us, and we refer when we can to them. And they called today asking about those business cards, right? To send them more business cards. And I said, oh, I guess they haven't reached you yet because of the holiday, because it was a holiday when I sent the package. And I thanked them for everything. And she said the nicest thing. She said, well, thank you so much for everything you guys do for our patients.
That's what I love to hear, because I think when I developed this program back 35 years ago, going into private practice as a therapist, we're really out there trying to be an extension for a doctor, a part of their team when they have a patient who's suffering with this, that we can coordinate with them. That patient will get the care they need at our center. They'll go back to that doctor for reevaluation and any adjustments that the doctor needs to do with medicines or medications or any other procedures. And so that combination is ideally how I loved working with doctors and patients. So it's a team effort. And so it's a big honor when a physician's office looks at us as a part of their team. So that compliment right there it means everything to me. That's fantastic. Thank you for sharing that, Esther.
Yeah, it was really beautiful to hear her say that. And it was just an amazing exchange, because we don't always hear from the doctors. But when we do, it's usually a very positive experience. So it's really great to hear that. Um, so Tom, tell us, let's describe the clinic, now that they know what we do in the clinic. Now let's describe to them the environment, because, so people can really get a picture of the clinic. And inside the show notes, once we post this, they can actually go there and actually see the clinic. I created a little video of the clinic, so they're welcome to go check that out. But for the viewers that are listening, let's describe the clinic to them. So I'll let you take the lead on that.
Okay, I think I described the waiting area. They'll meet you. Then we've designed a nice little. It's a one-story building, so you can park right in front of our building and walk right in. We made that easy. We wanted a location that was easy for balanced patients, not to deal with elevators and big buildings and long walks. So it's a very easy environment, easy office to access, plenty of parking right in front, and it's a one-story building. So once you get in, we have a little gym, we have a gym area. It's not, it's we have different workstations that I've created over the years that I found have been the most effective. So we have patients working in different areas. We have several treatment tables where they'll be doing exercise sitting or resting or doing exercises on those treatment tables. We have this computerized balance system, which can be used then for visual biofeedback to retrain how they move their center of gravity. So patients really love using that system. So we have a variety of ways variety of stations and exercises in the clinic that are very different than you think of a regular gym. And sometimes we think of a gym and you got weights there, you're lifting weights and machines for making your muscles strong. Our clinic is specifically geared to the retraining of natural movement, how we move through our environment, walking, standing, turning, stepping, all these things that we have to do in our everyday life and is automatic to those of us who don't have a balance problem. But for those who are struggling, those are very challenging. It can be very challenging areas to deal with. So our clinic is designed to help them overcome and master those areas again, so they can get back out and deal with life without the restrictions that maybe might occur if they don't do this kind of rehab.
And then besides the gym, we have that beautiful acupuncture space
Yes, we do.
where we do the acupuncture, and we do have another acupuncturist in the clinic besides Tom,
Yes.
Annie
Yes.
Sturman. She is a colleague of Tom from a long time ago, and
Yes.
she's the one I cheated on Tom with. So eventually,
You're allowed. That's a good person
yes,
to cheat with.
that was a good person to cheat with. And she joined us right around the COVID reopening time. She closed her practice and came into our space. So she rents space from us, and we are so happy she's there. So there's, another option for you if you don't like Tom.
Yes, we have a team. It's a very good team approach within our office. Annie and it's great to have a collaboration with her as an acupuncturist. So I have my own acupuncture room. She has her own. We both do herbal medicines, vitamins, nutritional support, in addition to we have cold laser, we do cupping, electrical stimulation to electroacupuncture. We can stimulate the needles. So we've really got a very comprehensive system for providing the best care we can for our patients. And we
And
and
yeah,
and we
since
see that
since
we see them coming back for more and giving us good accolades about the work we're doing.
yeah, and since we're talking about it, go ahead and just mention a couple of conditions that acupuncture could help. If someone's out there listening and really wants to see if acupuncture would be a fit for them, could you just name a couple of things that, we could definitely help?
Well, we deal with chronic pain, back pain, neck pain, right? Knees, ankles, shoulders. We talked about for the vestibular patient, there's a thing called cervicogenic dizziness. Sometimes the neck is a big part of what's causing the problem in the inner ear or with the inner ear. So we want to work on releasing any neuromuscular issues in the neck. Oftentimes, I think I mentioned earlier, we do a little work on the TMJ, as well as maybe migraines or tension headaches, inflammation around the ear. Those are things that I really focus on. But I've worked with athletes, professional athletes, done sports medicine acupuncture. So and then we really helped them with their nutrition. So acupuncture is this broad spectrum of service for a variety of conditions. So there's so many to speak of. I might be forgetting some of the main ones, but these are the ones that come to mind, when it comes to headaches, migraines, dizziness, ear problems, neck problems, shoulders, knees,
Stress,
backs. Stress is a big
stress,
one.
anxiety,
Yes,
all that kind of
yes.
stuff. Fertility, as we mentioned earlier. So many things. And also, what about avoidance of surgeries? Some people have used acupuncture to avoid surgery, right?
Yes, yes. I think acupuncture is a great tool, for us that have learned this tool to help retrain and rehabilitate the muscles and the nerves in the body. So, there's another thing that I do a lot of work with is lower extremity neuropathy for our balance patients. So the acupuncture is very helpful with when patients are losing some of their feeling in their feet or legs. So now they're more unsteady as they move around, especially on uneven or compliant surfaces or various angled surfaces. They might have real trouble walking around on those. So the acupuncture combined with the therapy has been very helpful in helping these patients move forward, in a more optimal way.
Excellent. Yeah. So, and I've had acupuncture too. I don't know if I mentioned that. Yes, I did. I did. Yeah, acupuncture is definitely amazing for so many things. So I'm definitely glad that you did that. You listened to your angels on that one. So good job, Tom.
As far as going
Um,
back to school and becoming an
yes.
acupuncturist, yeah.
Yes, exactly.
Yeah, that was
Um,
when I saw it, like I said earlier, when I saw that this combination of being a practitioner of both, licensed in both, has helped me. Your question about do I ever get stumped? Do I ever not sure what to do with someone? These tools allow me to provide treatments in the way that in a natural way, a holistic way, and help them with, moving forward, even with they may be on medications or had a surgery recently. We can help them with the recovery and make things
excellent.
improve and facilitate that recovery in a much more optimal way.
Yeah, that's great. Um, so, as we get ready to wrap up here, I want to say that, I've had vertigo. Obviously, you were there during that process with me. I've never had full-blown vertigo. I've had wooziness. I've had similar kind of symptoms now that I'm in the world of vertigo. I understand that I had a subtle situation back in the day. And I also had motion sickness and things like that as a child. But I will tell you that what we do in the clinic, I've been able to avoid having vertigo again. I had it in 2021. I was actually the first beta tester for our online program, Woozy, right? Online vertigo recovery training. And
That's spelled Wuzi, just for our audience to make sure they understood that. That's a play on the word woozy. So if they're looking for that online, maybe you'll provide a link for them. That is an
yes,
online program, and you were a very helpful part of that. We worked hard on trying to take everything we could, especially during the process of COVID, and put that online so that patients could do this program wherever they are in the world. And we have a lot of patients who use that as a part of their maintenance program. So they'll do the online program, the online videos are there with specific instructions on how to maintain their gains and how to move through the program. And it's a great, I think it's a great tool, really great tool for those patients in particular who are live at further distances from our clinic or are not in our area.
yeah, it is a very good program. Definitely agree on that. And we've done some tweaks on it so to make it easier and workable. The one thing I do want to urge people is that you don't have to suffer with these conditions. There's a lot of people out in the world that are really just, okay, I'll just live with it. I get these
Yeah.
bouts once in a while and it's okay and it moves through and then I don't have to get it again and it's okay. Let me tell you something for those listeners, okay, and you may hate me after this and completely disconnect from my podcast moving further. Let me tell you something. It doesn't work like that. If you've already had these bouts of vertigo, you will continue to have these bouts of vertigo and they will get worse because it's the body telling you something is wrong. We have a philosophy that we call reveal to heal, right, Tom?
Yes, I
It's
like
called
that.
reveal to heal. And so if your body is reacting in certain ways, it is trying to get your attention. So pay attention to those signs. And, there are solutions. There are solutions. You may not like the solutions. And that's usually what happens because there are, nutrition plays a huge role in this. And the exercises that Tom has created over these 35 years, I will tell you that these exercises are amazing. On an EQ level, they are really so much more than just vestibular balance therapy exercises. Can I tell you, Tom? I always tell the patients, your exercises are like mindful exercises. They are mindfulness exercises. It's almost like they're not for balance issues, they're for mindfulness issues. Okay,
Well, they're for
because
both.
well, they're for both, yes. So they are really designed in such a way that when a person is doing them, you really have to get present. You really have to be in the moment, where you are, really focused. And I will tell you that that is truly what EQ is all about, is learning how to be right here, right now, so that we can manage those emotions and that crazy. So thank you, Tom. Thank you for all the work that you've done up until this point. Thank you for being amazing and for being such a forward thinker and for being a pioneer, because Florida Balance Center was the first freestanding building, right, in Florida. Is that
Yeah,
correct?
but Florida Balance Centers was the first independent, private practice in Florida to specialize in vestibular rehabilitation.
Yeah. So he's very humble. And he will probably not have said that unless I brought that up. So, but I want to thank you and I want to honor you for that because, that takes a lot of cojones. It takes a lot of drive and he's all of that. So, and so
I like your
I want
I see you're working on your Spanish there, Esther,
to, yes.
huh?
Um, so I definitely want to, I just want to remind everyone that there is there are solutions. I've been vertigo free and I do the work to keep it away. And so it does require work. There's no one-stop shop solution and that's it. You have to do the work. So if you're willing to do the work and you're ready to do the work, we're here for you. Now, let's wrap it up. Let me just ask you, what would you recommend for a patient, as the first step to moving towards recovery? What would be, for someone out there who's suffering with this condition, doesn't know where to start, what to do? Do they call us first? Do they call their doctor? What's the first step?
Well, they can always go to our website, right? Balance Centers with an S. .com, and they can start to read all about our program in vestibular rehabilitation. They can even see the online program there as well. But in many cases, yes, we'd like a patient to also, if they haven't been seen by a physician, to maybe talk to a physician about what they're going through, to make sure there isn't medication conflicts or other things that might be really easily adjusted if that's the cause. So we want to rule out other problems. So, I would say that's another direction that a patient can go, but they really should dig in and get more information. If they've gone to their physicians, they've gone to an ENT specialist, they've been told they have this inner ear problem, and they're just not really recovering, then we're there for them. That's what we do. We're there to help them get through that process of recovery. And then they can find out about who we are right from our site. And then they can contact you, Esther. Our phone number's there, and you can have further conversations with them. And you've been great with that. So I think the patients love talking to you and hearing your description of what we do. You're an amazing, like you're doing now, you're an amazing broadcaster. You like to support the work that people are doing. You like to talk about how EQ is a part of us all. Like we all need to look at emotional intelligence to help us move forward in life in a better way. So I would say all those things they can do. Look it up,
Any
find our site.
Yeah, find the website. And I will definitely put it down below, balancecenters.com, and I'll, we'll put the phone number and all that. Or when you go to the website, actually the phone number is there. So it's very easy to find. So any final messages, Tom, for the patients?
I would say,
I
if
mean,
you're
for people listening out there, sorry.
Yeah, and even if they're a patient or not a patient or someone who knows somebody with this condition or it's themselves that's struggling with this condition, is don't give up. There are ways to overcome these things. We like to provide a lot of hope, realistic hope, not just pie in the sky kind of hope, but realistic hope. We're realistic about what the recovery can be, but people need to understand how to do the work. It has to be done in a specific way, and we're there to coach them through that. And I think if they have the desire to improve and to live a better quality of life, and they're motivated, then come check us out or check out another program like ours. If they're not in this area, so they should really not give up. They should pursue the right kind of healthcare practitioners who can help move them along on their journey to health and wellness.
Yeah, excellent. That's a great way to say that. Absolutely. And okay, so thank you again, Tom, for being here. Thank you for supporting the work. And thank you for being a pioneer and everything that you've done up to this point. And I'm just so, I'm so honored that I got to be in this world, because I know that for me, I definitely was never looking to be a part of the balance industry or, into vestibular balance therapy or vertigo or any of this. But, the world and the universe has your back. And I know that when I was meditating for my partner, finding the right partner in my life, and I was also, asking for guidance with career and all the things, right? I kept saying, I want balance. I want balance. And I
Well,
guess,
you got it. You
I
certainly
guess the
came to the
universe
right
heard
place,
me.
Esther. They did.
I guess the
They
universe
did.
heard me and said, okay, well, you should go to the balance center. And so here we are.
And
So
Esther, I got to acknowledge you for sticking with us. We went through the COVID crisis. You were able to revamp our office. You had to learn a lot of new front office skills on your own. And you've done a good job of creating this environment there that makes it real easy and comfortable and inviting for our patients. And it makes it work. So your tenacity to stick to things, to get things done, to, even if you stumble on something, figuring out how to fix it, whether it's our phone systems to, billing issues or insurance problems. Esther, you're amazing. You've been doing a great job with that. And I really appreciate you.
well,
And I love
thank
you too.
you. Well, thank you very much, Tom. All right. I know as we're professing our love to each other here, people
I
might be like,
know.
all right, you two, get a room already. And we will. So no worries. But anyway, okay. So let's wrap it up. Thank you guys so much for watching or excuse me, for listening to this amazing podcast today. To this wonderful episode all about vestibular balance therapy and what is Florida Balance Centers and the crazies that run it. And as always, we got to finish with the quote. So Tom knows the quote, so he knows when to chime in. So here we go. Ready? All right. So when you know and understand yourself, the world will know and understand you too. And remember, what's the
What's the
best
best
that
that
can
can
happen?
happen?
And one piece I added, let's get crazy.
Okay.
So, so thank you all. We'll see you
All
on the
right.
next episode. Take
All right. Thanks,
care.
Esther. Bye-bye.